So I will be talking specifically about the part of Canada known as Nunavut. So where is Nunavut? It is in Northeast Canada, next to Greenland. It is actually approximately the size of Greenland. There are 25 coastal communities that dot the entire territory. There are about 36,000 people, and 84% of them are Inuit. They are indigenous to the land. So that is my context. And the topic of my PhD dissertation is going to center on food security. So I think we all have a pretty good intuitive sense of what that means, but the World Food Program definition states that food security is met when there is available and adequate access to sufficient, safe, and nutritious food. And there's actually a high prevalence of food insecurity in Nunavut. About 57% of the total population is food insecure. And that statistic rises in certain vulnerable subpopulations like preschoolers. About 70% of preschoolers have been estimated to be food insecure in the territory. So one of the other things that's happening around the world is what's known as the nutrition transition. So globally, this is a phenomenon whereby there's an increasing reliance on processed Western foods. And this is correlated to an observed rise in body mass index or obesity and overweight, heart disease, diabetes, and other chronic illnesses. And in Nunavut, traditional food is known as country food, and there has been an observed shift toward market food. So what country food includes is anything that's harvested from the land or the water. That could be Arctic berries, it could be caribou. You see a picture of char, which is a fish here. And then there's a shift being observed toward market food. So that can include processed food, shelf-stable food, but also some produce, which is subsidized but still quite expensive, as you see a $23 baby watermelon here. We also know that climate change is disproportionately affecting the Arctic. And here we see a map of northern Canada, and you can see that Nunavut is experiencing some quite large anomalies in mean temperatures. And this is a March 28 temperature kind of mapping as related to the previous nearly 30-year average. So we're seeing a lot of warming across the Canadian Arctic. We're also seeing impacts of that and other environmental phenomena on identity, on hunting, as well as the health of animals that are to be harvested. So the arc, the storyline, so to speak, of my dissertation, I'm in my first year, is going to be how climatic extremes in Nunavut are impacting food security or insecurity, specifically of country foods, and what shifts may be resulting in diet and nutrition. And finally, what are the impacts on chronic disease in the territory? So you can split this cascade into two groups that have been pretty well studied. This forend, where we see how climatic extremes are impacting the ability to hunt, the ability to acquire country foods, that has been pretty well documented. And then there have been various studies in Nunavut, but also more so in other Arctic contexts on how the nutrition transition is leading to rises in chronic disease and challenges to public health. My dissertation will focus on the full arc of that story in Nunavut. So to begin, in looking at climatic extremes, this summer I'll be starting my PhD research with some qualitative interviews with hunters, trappers, and elders in a handful of communities. And we'll be exploring how bad years or how climatic extremes impact their ability as frontline procurers of country food, how it affects their ability to bring back the bacon, so to speak, to their community. And then I'll be deploying a territory-wide or territorially representative food security survey, the first, hopefully, of its kind in over a decade. So it's well needed to understand and estimate the current burden. There will also be an analysis of grocery store transactions. We're in conversation with one of the large chains for the territory so that we can develop a mutually interesting analysis of how bad years or climatic extremes are impacting people's choices in the grocery store as they relate to market food. And then hopefully we can thereby profile or estimate impacts on diet and nutrition. And then finally, I'm looking to partner with the government and related entities to estimate the public health impacts, specifically around the prevention and management of chronic diseases, whether or not they relate to different climatic trends. And I would like to thank you. This is a picture of Arctic berries that I picked with my host family in an area outside of Rankin Inlet, Nunavut. And I would also like to state that I'm really looking forward to learning from and engaging with the food security and health and well-being communities through IARPC, but open to any feedback from anyone. So thank you for your time and attention.